Okay, this is scenario 22, and it is an insulin injection. So first I would look at the order for the amount, purpose, the reason why they're getting this particular medication. So for this particular person, she's getting insulin for her diabetes, so it's insulin and 16 units, and regular insulin by sliding scale every morning, subcutaneous. So her blood sugar this morning was 6.8. So I look at the sliding scale, and it's 4 units of regular insulin. Okay, so first I got all my supplies, so insulin needle, alcohol swab, and gloves. So I got all my supplies. Then I would go assess my client. So I would check her vital signs, any problems she may be having this morning. I'd obviously already checked her blood sugar and any contraindications this insulin might give her. So after that, I would go to the MAR and do my 3 checks. So it's insulin N, so normal insulin, 16 units. So I'll check it against the MAR, and then okay, and then and it's regular insulin. I'll check it. All right, it's the right amount. And I also collect the proper data to give this medication safely. Okay, so before I inject the medication, I would swab the top. I would swab the top of both. And I would inject 16 units of air into the first needle. So 16 units of air is going into the insulin normal. Injecting it and taking it out. And then for the regular insulin, it is supposed to be 4 units. So I'm going to inject 4 units.
Oh, this is what?
It's, the top has already been swabbed. Inject that in, and then go like this and pour it out. So there's 4 units of regular insulin going into there. There are just one tiny air bubble. Okay. And then I would swab it again. And withdraw 16 units. So in total, there should be 20 units of insulin in here. Okay. So there's 20 units of insulin here. And before I give it to my patient, I would need to double check with another nurse. So I'd ask another nurse, is there 20 units of insulin in here?
Yes.
Perfect. So then I would sterilely recap my needle. I can only put it in the right side. Lock it, and then I would go to my patient. And before giving this medication, I would have to say the 6 rights of administering medication, which are right drug, right dose, right drug reason, right frequency, right time, right site, and later, right documentation. So I'm just putting on gloves. Needle is capped, so I cannot harm myself. Okay. So for a subcutaneous injection for insulin, I'm going to do it around the umbilicus. So it's 2 inches around the umbilicus. So I would just say the umbilicus is right here. I would go like this. So it would go right here. So first I would swab the site. Just going around 2 centimeters around in a circular motion. I would mark the swab right there. I would dislodge the cap. For subcutaneous, it's pinched at a 45-degree angle. So I'd pinch it. I would inject it, stabilize, and inject at 10 seconds per 1 milliliter. So I'll just go at a good rate. Pull up, put pressure on it for about 10 seconds, and I would dislodge this needle. Throw this needle out without decapping it. So yeah. So obviously before giving my patient any medication, I would tell them what they're getting and anything they should, why they're getting it and all that. And so yeah, I'll just clean everything up and throw everything out. Okay, so I'll come back in a bit later to see if they're having any adverse reaction to the medication. So that includes any hives that they're getting, if they're getting dizzy or they're starting to run a fever. So that'd be an adverse reaction, and I would make sure to contact the prescriber right away. Another thing, before administering any medication, I should have checked the two identifications. So that's the ID band and asking them their name and date of birth. That is all. I would also make sure that my patient has adequate privacy while giving them an injection. When giving the injection to my patient, I would ask them to lie down so I can get in a supine position so I can get to their abdomen easily. So I'm just redoing so I can show clearly how much insulin I'm drawing up into my needle. So I'm just going to redo the asepsis technique and reconstitution. So first I'm going to swab the tops of both insulins. So swab, and then swab, and then I'm going to decap my needle, and I'm going to put 16 units of insulin into the first container. So they're going up in increments of 2. So 16 units is going into the normal insulin. So 16 units in, and then I'm going to swab this end, and 4 units are going into the regular insulin, going up in increments of 2, so 4 units would be right there. And I'm going to stab it, and there we go. And now I'm going to draw up 4 units. So 4 units of insulin right there, as you can see. And now I'm going to draw up the rest of the insulin. So it should be 16 more units for a total of 20 units of insulin. Okay. Just going to get rid of the air bubble. Getting rid of the air bubble. Okay, and there's 20 units of insulin. So there we go. You can clearly see how much insulin is in my needle, and we're good.